All right, so your surgery's over. All the anxiety that you've had, all the worry and concern leading up to this moment is finally past, in your home and hopefully still comfortable. But at the same time, lying there in that hospital bed, looking up at me as we went over all the information that is probably in one ear and out the other, and maybe even the family sitting there next to you didn't pick up, is pretty common. So what I hope to do in this video is to share with you some of the most important or pertinent information with you so that you can make this postoperative experience as easy as possible. So number one, you may notice numbness and tingling in your fingers. You may have even had a block that made the entire extremity feel numb. That is normal. So that will continue to fade over time, and you may have experienced some of that numbness and tingling going away already, depending upon when you're viewing this video. So if you're numb and feeling great, but ready to go to bed, you still may want to consider taking your pain medication. It's very difficult to play catch up if you're waking up in the middle of the night with a lot of pain. If you're already experiencing some reduced numbness and discomfort, by all means follow the regimen for your pain medication. Second is you're given an anti-inflammatory medication to complement the narcotic. You have your pain pills, and then you have the non-steroidal anti-inflammatory, which is usually in the form of an ibuprofen prescription at 600 milligrams. So unless you have a reason why you should not take that medication, for example, kidney issues, stomach problems, or you're on blood thinners, and you happen to have received that prescription anyway, don't take it, just discard it. But if not, the two medications together can work very well synergistically to reduce the overall narcotic need. Also, as your pain level continues to decrease, you can simply take the ibuprofen alone and get rid of the narcotic altogether. Also, we gave you something for constipation and nausea. Those are for precaution reasons only. Narcotics can be quite constipating, and I don't want you uncomfortable, so fill them if you need them. The bandage. So unless you were given specific instructions to change it after a week, I want you to leave your bandage on, keep it clean, keep it dry until your first post-op appointment, which should be set up for you already in about 10 to 14 days. But if you were given the instructions to change it, I want it on, clean and dry, at least again for 1 week. Afterwards, you can take it off, you can wash, you can shower, you can get it wet, but I just don't want you to soak or submerge it. Put a smaller bandage on afterwards, and we'll address the sutures at your first post-operative appointment. Now, the post-op again should be scheduled. Appointment date and time should be taken care of, and if for some reason that's missing in your packet, just give our office a phone call and we'll get a new date set up. Lisa, my PA, who's been with me for almost 9 years, is going to see you for your first post-operative appointment more than likely. She can finish my sentences for me, and she's quite capable. She'll get your sutures out and go over the process of where we go from here. Some of you may also receive a phone call from us to get you set up to see one of our therapists. So if you had a specific fracture treated potentially, you may want to see the therapist first. So that is a legitimate call. We're just trying to expedite things and expedite your recovery. Also, at your first post-operative appointment, if you're still taking any of the narcotic pain medication, you may want to consider having somebody drive you. I get lots of questions about when patients can drive, and the best advice I can give you is if you can safely control a vehicle and you are no longer taking your narcotic pain medication, it's all right to drive. I'd recommend trying an empty parking lot or a slow back street just to prove to yourself that you can in fact do it. Also, finally, the bandage itself may feel tight. You may be experiencing some increased pain, but usually that pain begins to diminish after the first 48 hours. So if you're struggling, ask yourself, what am I doing? Use good common sense. Simple day-to-day tasks are okay, but if you're struggling with pain, you're doing too much. You got to back off and slow down, and certainly if the bandage feels tight, you got to slow down, get your hand up, and elevate. Postoperative infections are rare in the early post-op period, but if you do find that as the days pass, you're noticing increasing pain, increasing signs of infection, including pain, swelling, drainage, foul odor, an elevation in your temperature, then notify the office immediately, and we'll make arrangements to see you sooner. If you have any questions or there's the perception of any emergency, or if it's after hours, you can contact our after hours line. We have a physician assistant on call who can reach out to you and answer any questions. Otherwise, we look forward to seeing you at your first post-operative appointment. Congratulations, your surgery is over and you're on the road
road to recovery.